Patients at Ohio State's Wexner Medical Center are among the first in Central Ohio to receive a new COVID-19 antibody treatment approved by the FDA just last week. With progress continuing on a number of COVID-19 medical fronts, NBC4's Matthew Herchick spoke to a patient today who actually received that treatment. And Matthew, how's that patient feeling? What did he say about the experience?
Well, Darlene, the doctors here at the Wexner Medical Center here behind me just received their first shipment for this new drug yesterday at about 1:17 p.m. The patient I talked to today said that he was already being treated with the drug by 2:30. So while it may still be a little early to know exactly how effective it was, he tells me he's feeling good.
I feel not fixed yet, but I do feel fine.
Just a little more than 24 hours after being infused with a new COVID-19 therapy, Pugh describes his reaction to the treatment.
I think pretty much as expected. I'm tired. I think probably some of that had to do with the fever knocking me down a peg or two.
It was last Monday that Pugh began to feel ill.
It felt like a chest cold coming on.
By Thursday, he had tested positive for COVID-19. Now, just yesterday, Pugh was among the first patients at Ohio State's Wexner Medical Center to receive the treatment from Eli Lilly, approved for emergency use just last week.
I had no idea of this specific drug and that it was available.
But because of a variety of pre-existing health conditions, both Pugh and his doctors were worried about his symptoms progressing, making his interest when he learned of the treatment a no-brainer.
If I'd gotten ill enough to be put in the hospital, it would have been a rough run. So we all figured it was definitely worth any risk that was there.
So how does the treatment work?
It takes about an hour for the administration of the medication. We will monitor the patient for about an hour after the infusion.
Then the patient simply heads home to continue their recovery. So far in trials, medical experts say the drug has shown to significantly reduce COVID-related hospitalizations and emergency room visits. A significant breakthrough as COVID-19 cases continue to rise.
Anything that we can do to keep people out of the hospital at this point in time is a huge advantage for us.
Dr. John Parsons there said there are about 10 patients that have been treated here at the Wexner Medical Center already. He said they don't expect any major side effects. He said all the patients are briefed on exactly what to expect when they get here, and there is a scheduled follow-up process once it's been completed. Local for you in Columbus, Matthew Herchick, NBC4.